I'm Danie'l Young. I live in Chalmers, Indiana. I am a holder of an associate's degree in applied sciences, and I own my own business, New Face Photography. I'm a photographer. When I was younger, I always had a full-time job. It always provided health insurance. When I became pregnant with my first child, I was then put on the Hoosier Healthwise, and then my child was put on Hoosier Healthwise. Because I had a child and I was a single mother, it was hard for me to work a full-time job. I had to have a part-time job, and a lot of part-time jobs don't provide health insurance, so it was coming out of pocket for me. Life happened. I had 2 more children. Again, same sort of thing. I was put on Hoosier Healthwise. My children were put on Medicaid. So at least at that point we were taken care of. And then now with 3 children, I have to stay home, and there's nobody to provide insurance for me through a job. I do have a fiance, and he has a full-time job. He has a great job. It doesn't offer insurance even for him. He has to go to an outside vendor to seek insurance. So even if it did offer insurance for me, though, I'm sure because of the number of employees that they have, which is very few, it would be very expensive for us to afford it for both of us and for our 3 children. By not having health insurance, I'm kind of living day to day, kind of just hoping and praying nothing terrible happens. After my 3rd child, I had a C-section, and at that point, I had developed a surgical hernia. And by the time that it had developed and really became an issue, I was already off of Hoosier Healthwise, could not afford insurance or anything like that. So at this point, I'm just kind of living with it and hoping that nothing would happen. Right now, the ulcer doesn't have a huge impact on as far as limiting me on what I do. I don't lift heavy things. I try not to lift over 20 pounds just because it could put strain on the situation, and basically it's not a good thing if it were to rupture or that sort of thing. So I just try and prevent that. But I'm still active. I mean, I still do certain things, probably things I shouldn't do. But I did have an issue a few years back. I had shut my finger in a sliding glass door, and I had cut it off. It was completely cut off. Of course, I had to go to the emergency room. I mean, that's not something I can salve up and bandage up and take care of myself. When my finger happened, I was lucky because most of my bills were taken care of by the government, state, Medicaid, whatever. They were written off for the most part, except for one. The one bill that I did have to incur, this doctor saw me twice for no more than 5 minutes each time. And it was a $1,800 bill that I'm currently still paying on. I have to do monthly payments to pay it off. Well, I generally just hope that on a daily basis I stay safe. Hope that I don't injure myself. I try and, if for some reason I have to go to the hospital for whatever reason, hope that I get lucky enough that, again, the state pays it off, or I'm in a position to be able to pay it off myself. I feel like health insurance it's a given right, just like, the ability to pursue the American dream. I feel like everybody should be able to stay healthy to pursue the American dream and not have to worry if they get sick because of the cost of getting yourself well. That's what's going to put you in the hole, not the actual disease or sickness. I feel like if there was a plan put into place where everybody can have health insurance that needs health insurance, then it would be a good thing. I think, of course, you understand that the doctors have to be paid, things have to be paid to be able to have electricity, that sort of thing. But it kind of puts a hinder on your nation if they can't even get well when they're sick. Obamacare is not the answer. Obamacare just made it so that everybody has to pay out of pocket for the same outrageous insurance costs and still not be able to afford it. Just because you make it a law doesn't change the world. People still have to eat. People still have to pay bills. And their health, as long as they're healthy, is the last thing that's on their mind.